Um, Working in the health post in Sama, it's very challenging because we have many patients every day. Some of the patients come with common problems which we are able to treat. Since I studied only nursing, there are some problems that I'm not able to deal with. So when they are very high complicated cases, it's very difficult. So that's one challenging part. And then the other challenging is like don't have electricity, and sometimes the electricity runs out. And if we want any information about some patients, we cannot serve it through the internet, or sometimes there is communication gap. We don't have phones, so we cannot contact to any higher health persons as well. The one specific case that I had to deal with it by myself was a girl who was around, I think, 20 or 22 years old. She had, I think in the beginning, she had some problem with her teeth, like dental caries. So she left it untreated, and then when she came to the health post, it was like 1 month that she has been having the problem. So she had like an abscess, dental abscess like this big in the neck and all around her neck as well. And then I tried giving her some antibiotics, but it seemed like it didn't have any impact on it because it was too late. The problem was too late to be treated. Then she had a lot of abscess, a big abscess, and then she said like she has pus coming out from the mouth, or that she can feel the pus, she can taste the pus when swallowing. So in that time we had no telephone because it was during the winter. We didn't have any telephone, and we didn't have any like electricity through which I can serve it through the internet. So what I thought I could do was I gave a little bit of incision in the neck, just a little bit, and then I put a syringe in it and then drew out all the abscess. I drew out around like 15 ml of abscess. It was like it had been very foul smelling, and it was a very bad abscess. So after that, I was very scared. I told her to that she has to open her eyes and like try to talk to me every second because I was worried that I could kill her. I didn't know what to do, so what came in my mind, I just did it, and I was just praying to the God to help me, and I did. And then at last, I drew around like maybe 20 ml of the abscess, and after that, I didn't like dig further into because I was just scared, and then I left it like that, and then I did a bit of dressing, and then I gave her some very strong antibiotics for 7 days. And after 7 days, she came back. The abscess was like totally gone, just a little bit left. And then I added again 7 days of antibiotics, and then she was totally fine. And then after like 2, 3 weeks, she came back to say that she was totally fine, and then she was like back to normal. She was very happy. So that was one case I dealt. And then even nowadays, when I think about the case, I feel like God was there who saved me, because the neck is a very critical, is a very like a delicate place. So I didn't know where like the nerves would be or where the arteries could be. So I just did what I could do, and then I think I was lucky because I didn't cut off any of her nerves or did anything wrong there.